Policies of governors in states with excessive numbers of coronavirus deaths in nursing homes specifically are prompting new calls for an investigation. That's according to One America's John Hines in Washington.
Pennsylvania Congressman Scott Perry has joined with GOP members of the Select Panel on the Coronavirus in demanding that the Pennsylvania Attorney General investigate whether or not the governor forced nursing homes to accept seniors who were COVID positive.
What has happened, especially in Pennsylvania, but some other states, is our governor's policy is that nursing homes, the place where elderly live, whether it's nursing home, elder care facilities, assisted living facilities, must take COVID positive 19 folks into their facilities. And so in Pennsylvania, we have a horrific death rate. And then you have the state attorney general threatened to prosecute the nursing homes for murder. It's outrageous.
Perry is one of more than a dozen House GOP lawmakers who have sent a letter to attorneys general in 4 other states and Pennsylvania, demanding an investigation, offering proof that these governors gave orders to nursing homes saying they must take in elderly patients with COVID-19, and that this was a tragic misreading of the directives from the CDC and also from Medicare Administrator Seema Verma.
The investigation should happen everywhere, but of course, as a Pennsylvania representative, I'm particularly interested in that. The administration in Pennsylvania is looking to blame all the issues on the nursing homes when the nursing homes had no choice in the matter. And the administration's also turning to the federal government saying Seema Verma required them to do this. And we showed very clearly that's not the case. And so the outcome is predictable.
A predictable outcome based, apparently, on the numbers. Of Pennsylvania's some 6,600 COVID-19 deaths, some 4,500 of them, or about 70%, have occurred in nursing homes or senior care facilities. Nationally, nursing home residents make up just 0.6% of the population, but they account for 42% of nationwide COVID-19 deaths. All of which also prompted Perry to request an additional inquiry from the U.S. Department of Health and Human Services Office of Investigations.
Well, we're asking for an investigation from the outside. The only way we're going to get a fair shake is an outside look by the federal government, to not necessarily to throw stones, but to make sure that this policy ends as dangerous and to make sure it doesn't continue.
Perry also points to a March 18th memo from the Pennsylvania Department of Health that says nursing homes must accept COVID-19 residents. John Hines, One America News, Washington.